So did you see your doctor after the incident?
No, I just came to see fabulous massage therapist.
Well, thank you very much. So bringing me back to the incident, how exactly did you fall?
I fell on my hands and knees, but I didn't hurt anything else.
Okay, so specifically you didn't hurt your head.
No.
Okay, that's very good. Yeah, that's really helpful to treatment. Did your leg give way at the
Yep.
time of injury?
Yep.
Yeah, you remember your leg sort of just randomly just
Yeah, I
letting
just
loose?
fell.
Yeah,
on the ground.
spontaneously letting go. Okay.
Yeah.
That's also useful information. Um, so how long did the swelling take to set in after the injury?
Like this morning.
Oh, okay, so this was like 24 hours after the injury?
Yeah.
Okay. Excellent. That's also good. So what exactly are your functional limitations, would you describe?
Okay. I can walk. Like when I'm walking, it really hurt, and also for standing
Okay.
and going upstairs also.
Alright, so walking, standing, and stairs more specifically?
Yeah.
Okay.
Yeah.
That's good to know. So, talking about the pain that you experience in your leg, how would you put it on a scale of 1 to 10? 0 being no pain at all, 10 being the worst pain you've ever felt.
I would say 6.
Okay.
Yeah.
How would you describe the pain?
Oh, it's kind of like a aching, and it's like burning.
Aching and burning. Okay.
Yeah.
Are you having any trouble sleeping?
No.
No? Trouble sleeping? Okay. And nothing wakes you up at night?
As long
Alright.
as I don't really touch it hard. So.
Yeah, as long as you're sitting comfortably.
Yeah.
Exactly. So where exactly is the pain? The specific location?
It's just like around here. You see my this bruise?
Yeah, directly on
Yes.
top of
Yeah.
the bruise? Alright. And it's not radiating elsewhere?
No, it just stays here.
Okay. So what sort of things aggravate it, aside from walking and standing and stairs?
When I'm using my legs, I think.
Okay.
And
Just in general.
yeah, and I can touch hot stuff, like hot pad, doesn't work for me.
Okay. Have you had any new pains since the injury?
No.
No. Okay. So there's you wouldn't have like maybe muscle tightness on the opposite leg?
Yeah, after I got injured, I feel this leg is really tired.
Okay.
Yeah, hurts.
And I would assume that took about 4 or 5 days to start
Yep.
at the most?
Yep.
Okay. I think I like the questions so far.
Okay.
So now I would like to perform some special tests and general assessment of your knee. The purpose of this is to establish exactly what is wrong with your knee, the exact structures that are involved. Some tests that I will do might provoke some pain. So that being said, I want you to know that the pain can never go above 6 or 7 on your pain scale. But I need to provoke pain sometimes to understand which structures are affected.
Okay.
Consequences that you might of not doing this assessment is that I won't be able to establish exactly what is wrong with you, and therefore will be able to treat you as best as possible. So at any given time you have control and you can stop the tests if you are in too much pain, especially, but for any reason.
Okay.
I'll be checking in with you regularly to make sure that it's not too painful and that you're comfortable. Maybe you want another pillow in a certain spot or something. I'll just keep checking in with you to make sure that you're okay. Do you have any questions?
No.
Do I have your consent to perform this assessment?
Yes.
Based upon the information that I've gathered in the interview, I would like to move forward and do some tests and different observations and basically an assessment. Some of the assessment points are going to cause some pain. I never want to see a pain more than 6 or 7 out of 10, which is a scale we discussed.
Okay.
want you to know that I'll be checking in with you often to make sure that you're okay. Based upon this information, based upon what I've said, I just want you to know that you have control over the assessment and you can stop at any given time. And that you, do you have any questions?
No.
Do I have your consent to perform this assessment?
Yes.
Okay. So the first thing we're going to do is blood pressure. If you can take your left arm out of your sleeve.
Okay.
Excellent. First, I'm going to palpate brachial radial artery. If you push against me. Excellent. That's okay. Palpate your radial artery to ensure that zero pulse cuts out. Good. 100, so I'm going to perform the test at 130. It's not too cold, is it? No?
No.
So, I got a blood pressure reading of 112/81, which is right within normal range.
Yeah,
Slightly
it's
low.
normal. Yep.
Okay. So the next step is I'd like to do some observations. So, walking into the office, I noticed that you have certain weakness in your walk, and I will be performing some tests to make sure that some things certain muscles are weak. Looking at your bruise, I can see that it's yellow and green, which tells me that it's in a subacute stage.
Yes.
And based upon the information, I established that it is a second degree contusion. So if I can have you stand up, I'm going to do a postural assessment really quick.
Okay.
Alright. Check the space under your medial arch. Just noting that abnormalities there. And noting that your hip is a little bit low, which is going to throw off all of your posture. So I find it difficult to do an assessment of that. So the next step would be to check your edema. If you'd like to sit on the table for a moment.
Okay.
I'm just going to measure, actually, the amount of swelling that you have. So we have a base swelling measurement. Doesn't hurt, does it?
Not really.
So measured at 17 inches around. I'll check it again after the treatment to see if it's reduced at all.
Okay.
The next thing we're going to do is something called rule-outs, which means I'm going to be checking to make sure that your ankle and your hip are not involved or injured. So if I can have you bring your toes to your nose, please. Excellent. Is there any pain there?
No.
No pain? Okay, I'm just going to apply a little bit of overpressure. Does that hurt at all?
No.
Okay. And have you turn your ankle inward. Like this. Correct. Exactly. Is there any pain there?
No.
Excellent. And a little bit of overpressure. Is there any pain there?
No. Just like stretch here.
Just feels a little bit of stretching.
Yeah.
Okay. That seems normal, but there's no pain in the ankle.
No.
Okay. Now that we have ruled out the ankle as part of the problem, I'd like for you to lay down on your back so we can assess the hip too. slide on the right knee, the unaffected side, and then we're going to measure your affected side to see what the differences are between the two next. Okay?
Okay.
First measurement I'd like to get is in full flexion. So if you bring your knee all the way up, is that as much as you can flex your knee?
Yeah.
Right, so bring it down to full flexion. So now if you could bring your knee again. Next, we're going to be extending any possible hyperextension you may have. And if you could fully extend your knee as much as possible. Is that as much as you can do? 1 degree. Now that we've ruled out the hip and the ankle on the affected side, we're going to measure the knees. Going through active and passive resistive ranges of motion on your unaffected side first, I'll have you fully straighten your leg as much as you can. Is there any pain there?
No.
Okay, now bring it in full flexion or bend it. No pain there? Okay. Now allowing me to just passively move you. Is there any pain there?
No.
Okay. Is there any pain there? Okay. So now we're going to be doing something called resistive range of motion, where I'm going to be applying pressure on the joint, and I'm going to build for 5 and hold for 5. Basically, I just want you to hold against my resistance in a position that I have you starting. So starting here, just hold against my resistance. 1, 2, 3, 4, 5. 1, 2, 3, 5. I'll give you a green of 5 and 5 on that in strength, and to measure flexion, I'll have you hold against my resistance again. So for 5 seconds.
Okay.
1, 2, 3, 4, 5. 2, 3, 4, 5. And I grade you a 5 out of 5 again. Now that we've done range of motion on your unaffected side, I'm going to do range of motion on your affected side. If I could have you extend your knee as much as you possibly can. And now if I could have you flex it or bend your knee as much as you can.
Yeah.
So I can see that it's limited, and now I'm going to get a measurement with my gomiometer of the limitation in your ranges of motion. So I'm going to passively bring your leg into extension. Tell me which one I'm going to lead at. So is that
Yeah.
here? Now I'm going to bring your leg into flexion, bending your knee. And tell me when it's okay.
Yeah.
Okay,
That's it.
so it went from 30 degrees to 110 degrees. Means you have 80 degrees of knee flexion. You should be allowed. So we're going to see if we can bend that in 3 minutes.
Okay.
So now that we've done our functional assessment, I would like to do the special tests, some special tests, 4 to be exact. Some of them may cause pain. Just let me know if there is any pain and we can stop right away.
Okay.
Okay? And I just also want you to know that there's no way that we can modify these tests. So basically it's up to you if you want to continue or not. Okay?
Okay.
So the first one is called the Trendelenburg's test, and what I'm going to have you do is stand up and Yeah. So a lot of these tests you'll just be copying what I'm doing. So I'm just going to hold your hands. But what I'm going to ask you to do is take your affected leg and lift it, and just stand on one leg. Oh, I apologize.
Okay.
Yeah. So just flex your knee like so. So let me hold your hands
Okay.
just to hold you balance. All right. Is that painful at all?
Nope.
Okay. Okay. So I see that that's a negative because you seem reasonably balanced. And yeah, so yeah, and we can't do the unaffected side because it's just I don't want to make you stand completely
Yeah,
away
it's
bare on you.
painful.
Yeah,
Right.
that'll cause you pain. For the next test, I'll have you sit on the edge of the table. Basically, I'm just going to be looking for edema in your knee. So starting with the unaffected side, it's called the wipe test, basically. And starting on the unaffected side, I'm just going to swipe a few times on the inside, and then on the superior aspect of your knee, and then down the lateral side, looking for swelling to pool up in the bottom of your knee.
Okay.
Yeah. Right, so I don't see any there. And now I'm going to go to the affected side and swipe up. Is there any pain there?
No.
Okay. Any pain there?
No.
Okay. Is there any pain there?
On my knee?
Yeah.
Oh, no.
Okay. And I see no pooling. That is also a negative. The next test I'm going to perform is called the anterior drawer test. I'm going to do this test because a study from the Department of Radiology and Orthopedics at the University of Virginia found that the contusions near the knee can often cause a tear of the ACL ligament. So, at this point, I'm going to start with your unaffected side, stabilizing your foot and palpating the squishy tissue below your patella, and asking if there's any pain there.
No.
No pain? Okay, I'm just going to pull forward a little bit. Is there any pain there?
No, really. No.
Okay, I don't feel any excessive movement, so that is negative. And then I'm going to move on to your affected side. And again, asking if there's any pain. Any pain there?
No.
How about here?
No.
Okay, I'm going to pull forward again. Is there any pain?
No.
Alright. And that is also a negative. Yeah. So, the next test we're going to do is called Modified Thomas Test.
Okay.
For this test, I'll need you to hang your legs off the end of the table. And basically what I'm going to need you to do, once we get going with the test, I'm going to ask you to lay on your back. But what I'm going to ask you to do is take your leg and bring it to your chest. And I'm going to be observing the opposite side. So, if we can lay you down.
Yep.
And testing the unaffected side first, I'm going to ask you to bring your left leg to your chest. Lift your knee up. Yeah. Holding it underneath, bringing it as far up as you can. Okay. Is that too painful?
No, really. No.
Just a little, see it makes it a little bit uncomfortable, is that okay?
Yeah,
Okay.
it's okay.
Alright. And I can see that the opposite leg is raised off the table. And that is a positive. So now if you'd like to drop your legs carefully.
Thank you.
You're welcome. Okay, so we'll do the exact same thing with the other side.
Okay.
Alright, perfect. And I can see that your leg is raised off the table again. And this tells me that both legs have very tight rectus femoris muscles.
Okay.
So Tiffany, I'd just like to talk about the treatment that we're going to be working on today. The main goals, what I'm going to be working on basically, is to reduce edema and swelling in your affected side and increase the range of motion there. And basically on the opposite side, I want to decrease the muscle tightness and general discomfort there, so you can walk better and perform your other activities. I don't see any risks or contraindications, nothing that we've done so far that would go against suggest that I shouldn't do any of the techniques that I'm going to be doing. Just want you to know that at any point in time, like you do have control just as much in assessment to stop or continue the treatment. Yeah. So. Yeah, so basically another thing I would like to talk about is the pillow that we're gonna using a secondary pillow underneath here to increase your comfort zone. Because, and we're gonna be using heat on your unaffected leg to help increase the relaxation aspects there. Do you have any questions?
No.
Okay. Do you have your consent to perform this treatment?
Yes.
Excellent. So at this point, I'm just going to discuss with you, so I'm just going to be leaving the room. I'm going to go wash my hands and stuff. What I'm going to ask you to do is get between the sheets, right here, laying on your back, and and having your legs hanging over the pillows again, and so I'll just let you know before I come back in, and I'll let you know when you're secure.
Okay.
All right?
Thank you.
You're welcome.
Okay. I'm okay. Come in. Yep.
Are you comfortable?
Yes.
Do you enjoy the second pillow I put in there?
Yeah, wonderful.
Yeah, the second pillow is good to help drain it. Edema. This one might be left underneath. Put some heat. Quite light. So the first thing I'm going to be doing is draping to your gravitral cage. I'll be performing some active pain-free range of motion for the left knee. And then we're going to do some lymph drainage techniques. And then we'll move on to the right leg. Is that comfortable?
Yeah.
How's that feel?
Good.
I'm just going to roll the edge in here. So I really need you to communicate with me about how your pain is feeling. I'm just going to try and make sure that it's pain-free more than anything. I'm just going to feel like here.
Yeah.
Is that painful?
Yeah, a little bit.
A little bit? Okay. Hold that.
Good.
How's that feel?
Good. Like no pain.
Nice.
It's very gentle.
It's nice. It's a very light tapping. While I'm doing this, I'm gonna have you practice diaphragmatic breathing.
Okay.
So basically, have a deep breath. Fill your belly. Fill your chest. Exhale. This breath will need to work on expanding your chest, not filling the lungs. Concentrate on breathing. How does this feel to you? Feel floating?
No.
Just let it go.
Okay.
So don't force your breath. Continue breathing. Expand your chest. Use your muscles. Exhale. Empty your lungs.
It's like, yeah.
Continue breathing. So the first thing I'm going to do on this leg is assess your tissue, your fascia, see if it's all adhered together. Wonder if it rolls into your. Yes, I can feel your fascia is very tight. Your rectum is very tight also. That would explain the pain you've been having on this leg. Now that I've assessed it, I'm just going to roll the tissue. How's that feel?
Good.
First thing I'm going to do is skin roll. It should be a little bit painful, but just
Yeah.
give it a touch. How's that feel?
A little bit of painful.
Don't want anything to go over like a 6 out of 10 on the pain scale that we discussed.
Okay. That is
press is so tight. I'm doing some muscle stripping. Fender top band. Oh, there's a twitch.
Yeah,
Okay, yeah, we
hurts.
both felt it at the same time. Okay, so that is with the twitch response and the pain. I'm pretty sure it's a trigger point. So what I'm going to do is I'm going to need to communicate with you very clearly about the fact that I don't want to see the pain go over 6 out of 10.
Okay.
It's got discussed. So what I'm going to do is I'm going to push down on the trigger point. I want you to tell me when it's uncomfortable or 6 range, and then I'm just going to hold it there for a period of time, and I want you to tell me if anything changes. Okay?
It's like 6.
6.
Yeah.
Okay. Let me know if anything changes. Dropping?
5. Yeah.
Okay, let me know if anything continues to change. Because I heard it. Did you feel it sort of disperse?
Yeah.
Okay. Push it down once more and let me know when it's uncomfortable. Exact same communication.
Yeah, it doesn't hurt that much. I still a little bit pain.
Okay. See if I can. Did you feel that twitch?
Yeah.
Is there pain on that one too?
Not really, like 4 or 5.
Well, I kind of still feel some twitch response. Is there any pain, any more pain? Well, I felt the one trigger point release. We both did, so. That concludes our treatment for today.
Okay.
Just to finish this one off, I'm going to put some heat back on here. After a trigger point, that's important. And stretch. Stretching is something that is also important after a trigger point, which is something I'm going to need you to do at home, as we discussed. How's that feel?
Good.
So just, I'm going to leave the room and I'm going to have you put your clothes back on and I'll come back in and we can talk.
Thank you.
You're welcome.
Now I'm going to recess the range of motion of your knee.
Okay.
Just as we did before. So what I'm going to do is I'm actually going to extend your leg, and I want you to tell me when it hurts.
Yeah.
There's pain there?
Yep.
Okay. Just hold it here. Measurement of that. Excellent. And we've seen it change. It's better than it was. And how about on the flexion side?
Oh yeah.
Is that painful?
Yeah.
Right there? Okay. Excellent. It's also increased as well. You've gotten a full 15 degrees extra motion in your knee. It's good to hear.
Awesome.